Hi, everyone. Thank you so much for joining us today for our CCK Live discussion. My name is Maura Black. I'm an attorney here at Chisholm, and Kilpatrick, and I'm joined today by Rachel Foster and Bethany Cook, both of whom are accredited VA claims agents that have been working with me at CCK for a while now. Today, we're going to be speaking about insomnia. We're going to be talking about how VA considers claims for service connection for insomnia, how VA rates insomnia, and how this particular disability might dovetail with other types of requests for benefits that veterans have pending at the VA. So we're going to do our best to get through a variety of VA benefits points related to insomnia, but we're also going to include some information about what insomnia is, how it's diagnosed, and some of the medicine behind it. So Rachel, I want to start with you. Can you first start us off by explaining what insomnia is and sort of the hallmarks of an insomnia diagnosis that people should be aware of?
Sure. So insomnia is a sleep disorder. It's marked by symptoms such as difficulty falling asleep or staying asleep. So when you have insomnia, instead of feeling well rested, this person can feel pretty dissatisfied with their sleep overall, and experiencing some negative outcomes related to their energy level, their mood, even their health in general. In turn, those symptoms can also negatively affect your work performance and your overall quality of life. So with insomnia, there's really two main types. The first is acute insomnia. So this is a situation where someone is experiencing symptoms, but they're really only lasting a few days, maybe a few weeks, but generally not longer than a month. And then there is the second type of insomnia where it's more chronic, and these symptoms are a little bit more complex. They're occurring several times a week, and they're lasting longer than a month. But regardless whether you're experiencing acute insomnia or chronic insomnia, the symptoms are pretty similar. So a person is going to experience significant sleep impairment and have difficulty falling asleep at night. Maybe they're ready for sleep, they want to sleep, but they're up for extended periods of time at night. Or if they are able to fall asleep, they are waking up multiple times throughout the night, or they're waking up too early. Generally, you're just not feeling well rested after a night's sleep. And because of that, you can experience tiredness and fatigue and sleepiness during the next day. And that can significantly affect how you're going throughout your day. You can become irritable, depressed, anxious. This person might have difficulty paying attention in general, focusing on tasks. They might have memory impairment, things that they were able to recall fairly quickly before maybe. They're not able to do that anymore. And another symptom can be an increase in errors, whether they're making those errors at home or just in their daily life, and more prone to accidents. And because this person isn't experiencing a restful sleep, that can lead to more worry about sleep, wondering when you're going to be able to get enough sleep, wondering how you're going to be able to sleep, and maybe dreading the next time that you have to sleep. And that's causing significant worry and anxiety.
Great. And a lot of that information, Rachel, is going to be really helpful for later on in today's discussion when we talk about the ways in which VA rates service-connected insomnia or a condition that involves insomnia that's already been related to service. But Bethany, what are the potential causes of insomnia? And I think specifically those, whatever causes we're going to talk about and things that might be attributable to the development of insomnia are important to be considering if you are pursuing benefits for insomnia and claiming that it's related to your military service. So what types of things might cause this condition?
So there are a lot of different causes of insomnia. It's not always going to be clear in each individual case what the cause is. But like Maura said, it's really important to understand the potential cause so you know how it might be related to your military service. So just to talk about some causes, it's not an exhaustive list, but some of the most common causes might be a psychiatric illness, such as depression, anxiety, or PTSD. Insomnia might be a symptom or related to one of these conditions. Another cause might be chronic pain from other disabilities. So if you're, for example, service connected for a disability that causes you chronic pain, you might develop insomnia related to that pain. Another example would be chronic stress. There are also a lot of medications that can cause insomnia. So if you're taking medications for a service-connected disability, like antidepressants, diuretics, opioids, steroids, and even some over-the-counter pain medication, those might also cause insomnia. And a last example might be life changes or trauma. And I think it's also important to just keep in mind that there might not be a single cause. It could also be related to multiple factors, all of which, or even one of which, might be related to your military service.
So knowing all of that, I think one of the things that people might have questions about is how exactly can insomnia be diagnosed? I think that's a tricky topic just because, as Rachel mentioned, there's acute forms of insomnia that are not chronic, so they're not recurring. And I think pinpointing the cause of insomnia can be difficult if a person has a number of things going on, if it's a psychiatric condition of some kind, physical pain. Sometimes the two are involved at the same time, so it might be difficult to establish the specific cause. But there are certain procedures and tests that can be performed to try to formally diagnose insomnia. And this is an important point to keep in mind if you are thinking about pursuing a claim for benefits for insomnia, because VA will often be first starting by looking to see whether you have an insomnia diagnosis or whether you have a current disability. That speaks to the first of the three elements of service connection that VA is constantly wanting to see when they're looking at claims and adjudicating claims. So one of the ways that insomnia can be diagnosed is just through a physical exam. If the cause of insomnia is unknown, then a doctor might just be able to perform a routine exam that looks for certain signs and symptoms in a patient that would be consistent with insomnia. Another, I think, probably more popular way of testing for insomnia would be through a formal sleep study. Again, if the cause cannot be pinpointed, then sleep studies can be useful to try to figure out if a person is suffering from a number of sleep disorders, including sleep apnea, but also insomnia. And what the sleep study does is it usually captures a section of time, usually overnight when the person is sleeping, and it monitors certain physiological reactions during the person's sleep. So I think the types of things that are tested go to how restful the sleep is, which can indicate whether there's sleep disturbances or a sleep disorder of some kind. So looking for things like certain eye movements, breathing patterns, etc., while the patient is asleep, that can be very helpful information to try to figure out if an insomnia or other sleep condition could be formally diagnosed. And the last thing that a doctor might ask a patient to do if they're trying to figure out whether there is a diagnosable sleep condition would be to do a sleep study or a sleep habits questionnaire. So this would involve asking the patient a number of questions about the type of issues that they experience during sleeping, any other type of sleep habits, so nighttime habits or waking habits that might pinpoint the presence of some kind of disorder or condition that's affecting the person's ability to get quality sleep, and also in turn affecting their daily life for a number of the deficiencies that Rachel pointed out before. A lot of the lack of sleep problems can lead to other problems during daily functioning during the daytime hours. So all of those different testing formats might be used by different providers. But again, important to know that VA will be looking for evidence like that in most cases if the person who's maybe filing a claim or seeking benefits for insomnia doesn't already have a written diagnosis of the condition. Again, I said it before, and I'll just emphasize it again. VA is very diagnosis centric when they're looking to see if a person has a condition that could be related to their military service. So any kind of formal medical evidence that does diagnose a condition is going to be helpful, including in pursuing claims for benefits for insomnia. I want to go back to you, Rachel, to talk about treatment for insomnia. So again, insomnia can be something that causes so many different issues, deficiencies, problems for a person in their daily functioning. So how can it be treated?
Yeah, so kind of similar to the different ways that it can be diagnosed, there are different ways to treat it depending on the severity and the quality, I suppose, of the insomnia. So, if it really is a question of sleep habits, that might just involve changing those sleep habits. So, looking at the outside environment, looking at maybe the optimal bedtime, making those kind of slight changes to optimize the ability to sleep. If there are any underlying medical issues, then to get to the heart of the insomnia, you would have to address those other issues that could be causing the insomnia first. However, in more severe cases where insomnia is really the significant issue and it might be more long term or regimented in the patterns, different types of treatment can be more severe or more intensive cognitive behavioral therapy or stimulus control therapy. You can also learn relaxation techniques to help if calm your mind and calm yourself on a physiological level to let sleep happen. Sleep restriction and light therapy are different forms of therapeutic measures to try to treat insomnia.
Great. And now that we know more about what insomnia is as a medical condition, how it's diagnosed, how it's treated, and what the causes might be, Bethany, can you talk us through how insomnia might be eventually service connected? So if someone's filing a claim for benefits for insomnia, what are the different bases on which they might rest their theory that insomnia is related to service? Or what are the different types of things that VA might be looking for to find that link?
Yeah, so insomnia can be service connected, sorry, on either a direct basis or a secondary basis. So just to talk about direct basis first, veterans can be service connected for insomnia on a direct basis, essentially if they can prove that their insomnia resulted from their military service. So for example, if a veteran's insomnia first started during service and then continued chronically after service, that is one way it can be subject to direct service connection because it initially began in service and then continued. Insomnia can also be a component of a psychiatric condition, which is directly related to service. So for example, if a veteran experiences PTSD resulting from their combat service and also develops insomnia, then the insomnia might be rated as a part of the PTSD included in the psychiatric rating for it, which we'll get more into in a few moments. But first, the other way that veterans can get service connected is, like I said, on a secondary basis. So secondary service connection, which I know we have a lot more information available on our website about, is when an already service-connected condition causes another condition to develop. So in this example, it would be if a veteran has a service-connected condition which causes the insomnia. And the veteran would then be able to receive a separate disability rating for the insomnia in addition to the condition that caused it. So just to give an example, one would be chronic pain causing insomnia. So a common example would be if a veteran develops a chronic back condition and that back condition gets service connected. And as a result of the back pain, the veteran is no longer able to sleep through the night. Then the veteran might be able to claim the insomnia on a secondary basis and get service connection for it. Kind of a subset of secondary service connection would be aggravation. So this is probably the least common way that it gets service connected. But essentially, if a veteran has insomnia prior to service, and as a result of the military service, the insomnia worsens, or as a result of another service-connected disability, the insomnia worsens, then the veteran might be able to get service connection for the insomnia on an aggravation basis. In both of the secondary service connection examples, the veteran would need a medical nexus linking the insomnia to their service-connected condition. Just like if a veteran develops PTSD and develops the insomnia as a result, they would still need medical information attributing the insomnia to the PTSD.
That's all really helpful. And I think I don't know if you both would agree with this, but I think the most common setting in which we see claims for insomnia is usually on some kind of secondary basis or as related to another condition. As both Rachel and Bethany have mentioned, insomnia is usually presenting as a component of a psychiatric condition that's a common cause, it's a common connection. So a lot of the cases that we see deal with the underlying issue of service connection for a psychiatric condition, and then usually the insomnia comes into play on a secondary basis. Although I will say that insomnia is known to be a sort of a result of a psychiatric condition more generally. So I think that VA has an easier time conceding that if a veteran's psychiatric condition is related to service, then it follows that their sleep disturbances might also be. So I feel like VA is pretty good about making sure that ratings for psychiatric conditions encompass any type of sleep disturbances or issues that arise in the person's daily life due to those associated and sort of foreseeable effects of the psychiatric condition. All of that being said, people that are pursuing claims for insomnia should be aware that VA still might try to request C&P exams to try to determine the etiology of the claimed insomnia, even if the contention is that insomnia is due to an already documented service-connected condition, like a psychiatric condition or like a condition that causes a lot of pain, just to make sure that that medical link is there. So we talked earlier about the 3 elements of service connection really briefly. We didn't really talk about them. I just sort of mentioned them. But one of the first things that VA will look for is a diagnosis, which we talked about, making sure that if you do have a claim for insomnia, if there's medical evidence showing that you have that diagnosis, that can be very helpful. The second thing VA will want to look for is an in-service onset or some other service-connected condition in service or anchored to service that could serve as the in-service event or incurrence element of service connection. And then the last thing is medical nexus. So is there a connection somehow between service or a service-connected condition and insomnia? And that's usually where the need for a C&P exam comes into play. We have a lot of general information already on our social media platforms and on our blog about C&P exams. So exams for insomnia are usually going to function just the same as exams for other conditions, especially psychiatric conditions. It's possible that part of the C&P exam process will be a sleep study or some study that's tailored to sleeping habits, but it's not always necessarily the case. As with other C&P exams or compensation and pension exams, if I didn't already define that term, just in a fancier word for a VA provided exam. VA will usually request the exam as part of its duty to assist a claimant in developing facts necessary to substantiate their claims. C&P exams or VA exams are usually done through contractors, outside contractors, and companies that provide exams for people, but they're also sometimes done at VA medical centers or VA hospitals. And the exam is for the purpose of VA collecting medical information about whether there is a nexus between a claimed condition and service. Doctors or the clinicians that are performing the exams will usually ask standard questions about what the disability causes in terms of symptoms, what kind of functional impact the disability causes, and other general questions about the person's, disability pattern or presentation. In insomnia cases, they would be expected to ask questions about how the insomnia impacts the person's sleeping habits, but also their daytime functioning to get a complete picture of what the symptoms involved are. And then usually if it's in the context of a service connection claim, the examiner will be asked to provide an opinion as to whether insomnia is related to either a in-service event, some sort of in-service presentation of the disability, or another service-connected condition. So is it related to something that the veteran has already gotten benefits for? Again, we do have a lot of resources about C&P exams on our blog and our website. Something that we often do as advocates is respond to unfavorable C&P exams. So people in our position, me, Bethany, Rachel, others here at the firm, will be constantly reviewing the C&P exams that VA obtains for our clients' cases and figuring out how we can rebut them if they contain information that's not helpful. So it's good to be aware that if you do attend a C&P exam and you're able to obtain the report from the provider and it doesn't have a positive nexus opinion, or it doesn't contain information that you think is critical to your case and might be helpful, it's good to know that you can challenge those exams. If you voice your objections with whatever is in the exam, whatever you disagree with, whatever you think the examiner got wrong, that might help to persuade VA that they need to obtain a different exam or a new one, or some kind of addendum to make sure that they're relying on adequate and sound medical information in adjudicating claims. So there's a lot of other resources about that out there, but suffice to say that C&Ps are sometimes part of the process if a veteran is claiming service connection for insomnia or is looking for a higher rating. And speaking of ratings, we've been kind of alluding to this for a bit, but I think the most interesting part, in my opinion, of this discussion is how VA rates insomnia. So, Rachel, if a veteran has insomnia, what sort of process or what can they expect to see VA go through to make sure that they're adequately compensated and that they have an appropriate rating for that condition?
Yeah, so once all of the elements of service connection have been met and a veteran is granted service connection for insomnia, VA will establish a rating, which just relates to the monthly compensation that the veteran is going to receive, depending on the severity of that disability. One thing, just to make a note about the evidence that they review when they're establishing a rating, is that C&P examinations are very often part of that consideration, but that's not the end of the story. What raters are supposed to do is consider all of the evidence, the relevant medical evidence of record, whether treatment records, or even lay evidence if the veteran and collateral sources are providing lay testimony about the severity of that condition and how it impacts their day-to-day. So when considering all of that evidence, VA will establish a rating, but with insomnia, first they really have to look at the underlying theories that we've been talking about and how the insomnia has manifested. So if it's really just a component of another disability, like for example PTSD, and it's part of the PTSD progression and sleep impairment, will just be considered under the overall evaluation for PTSD. And just to back up for a second, VA will use, like all mental disorders, the schedule of ratings for mental disorders, which is the general criteria under 38 CFR section 4.130. So sleep impairment is, I think we've talked about it, considered under that diagnostic code and under that criteria. And if it is part of another diagnosis, it will just be compensated with that other diagnosis. If insomnia is a standalone condition along with another psychiatric condition, for example, a veteran not only has PTSD, but they also have full-blown insomnia, and that is a separate diagnosis, VA can concede that both might be related to service, they might be related to one another, but in order to prevent pyramiding, because there is going to be a lot of overlap with that PTSD or, for example, major depression, where sleep is still a component. So instead of assigning separate evaluations, which would result in pyramiding, essentially VA compensating the veteran for the same symptom twice, they establish one rating that considers both conditions, but all of the symptoms together, but they establish one single evaluation and compensate the veteran for that. So if the veteran's insomnia is not caused by a mental health condition, but maybe some other condition, like Bethany, I think you used the example of a back condition that's causing chronic pain, or any other type of orthopedic condition, VA can assign a separate disability rating for insomnia, because in that case, it's a standalone disability. There's no other overlapping psychiatric condition that's due to service, and they can rate insomnia based on the severity, essentially in its own right, in accordance with the schedule of ratings for mental disorders. Now, moving on to the different types of mental disorders, evaluations and the ranges, I know we've done many videos and posted a lot of information on our website about the general ratings for mental disorders, but just as a quick overview, the minimum evaluation for a psychiatric condition is 0%. So there is a diagnosis, there's a diagnosis of insomnia, or another condition if it's in conjunction with another disorder, but the symptoms are not severe enough to really interfere with your day-to-day, your occupational, your work, or just your social interactions. And while it might be a 0% rating, it's non-compensable, it can still create eligibility for treatment. So 0% is still, it's better to have it service connected. The next level up is a 10%, where it's occupational and social impairment, and the symptoms in that case are still kind of fairly mild and transient. They come and go. They still are not really affecting your day-to-day. And then a 30% is where your impairment, occupationally and socially, causes an occasional decrease in work efficiency. So your symptoms are increasing a little bit more in frequency, but they're still not persistent or constant, and they're more intermittent. And then a 50% is reduced reliability in occupational and social impairment. A 70%, we're seeing more significant deficiencies in most areas where your symptoms are affecting your ability to work, go to school. They're negatively affecting your family relationships. You're having impaired judgment, thinking, and mood, and things like suicidal ideation. And then the highest level is a 100%, which really represents total occupational and social impairment. Here is where we might see delusions or gross impairment in thinking, neglect of hygiene, and that is the maximum rating for a psychiatric condition.
And a lot of the consideration for how to rate insomnia, or at least how to evaluate its severity, is really, as Rachel mentioned, there's an emphasis on deficits in functioning in a social capacity and an occupational capacity. So it follows that if a person is seeking TDIU, or a total disability rating based on individual unemployability, which we have a lot of resources about this as well, will pay a person at the 100% rate, even though they may not rise to the scheduler 100% level based on the combination of their disability ratings. Insomnia and the symptoms it causes, if it's service connected, is very relevant to the TDIU analysis. So, Bethany, can you talk to us about things that might be important if a person has insomnia related to service or a service connected condition, and if they're also simultaneously pursuing TDIU?
Yeah, so like Maura said, TDIU is a really important benefit. It's essentially a way for a veteran to get compensated at the 100% rate, even if their combined rating does not get to the 100%, which can be really difficult to do. So if a veteran is unable to secure or maintain substantially gainful employment, either as a direct result of their sleep disorder, insomnia, or a combination of their insomnia and other service-connected disabilities, then they may be entitled to TDIU. I think it's really obvious that there are many ways that insomnia can impact a person's ability to work in an occupational setting. If someone's tired every day, then they're obviously going to have trouble focusing. They're going to be exhausted. They might develop irritability or other memory impairment, all kinds of other symptoms that could be related to the insomnia or related to the psychiatric condition that the insomnia might be rated as part of. So if you are finding that even if your insomnia or your psychiatric condition is rated at only 10%, if you're experiencing symptoms like this on a regular basis, then it might follow that you're unable to secure or follow employment. And if that's the case, then that might help you in your TDIU claim. Like I said, even if you have whether it's just the insomnia that you're service connected for or other service connected disabilities, the symptoms of the insomnia or a combination of all of the symptoms that you're service connected for might combine to you being entitled to TDIU. So if TDIU is already pending in your case, if you're service connected for insomnia, it's important to make sure that the impact of the insomnia on your day-to-day is of record. So if you have medical evidence talking about the symptoms of your insomnia or its impact on you, getting that of record is really important so that VA considers it. But they'll also consider your lay testimony. So you could even submit an affidavit talking about the impact that your insomnia or overarching psychiatric condition is having on your day-to-day, because the rating that you have for it, it's not going to reflect, the entire impact that it might have on you. And if you do get service connected for insomnia and it gets a lower rating or a rating that doesn't equal 100%, filing for TDIU might be something you want to consider if you find that you are unable to work as a result of it or your other service-connected disabilities.
Those are really helpful tips, especially you both mentioned at one point the importance of lay testimony. So I know we talked in the beginning about how insomnia can be diagnosed and tested and medical evidence proving its existence, but if you already are service connected for insomnia and are trying to increase the rating that's assigned for that condition or the conditions with which it's associated, lay evidence can be very helpful, especially if it comes from a person like the veteran or someone close to them that knows the impact of the condition on their day-to-day life. So that's very helpful. This has been extremely helpful, Rachel and Bethany. So thank you both so much for joining us. We hope that everyone out there who tuned in today finds this information helpful. We've mentioned this multiple times throughout the discussion, but we have a number of resources, including more videos on our YouTube channel and also at our blog at cck-law.com/blog. Our website's at cck-law.com. We've got plenty of information there about different types of claims for service connection, increased ratings, TDIU, special monthly compensation, you name it, we're trying to cover it. So if any of those issues interest you, definitely take advantage of the information that we've put out there. So again, Rachel and Bethany, thank you so much. And thank you all for tuning in, and we hope to see you next time.